Using feedback enables you to identify difficulties that may not be immediately obvious to you. I like to use a metaphor, which is that of the wing mirrors in a car. Most cars have wing mirrors. There's a good reason to have them. They allow you to look at your blind spots, the areas that you can't very easily see when you're driving the car and looking ahead. It's a good idea to check your blind spots because there may be danger or obstacles or difficulties. And if you're aware of the potential obstacles in your blind spots, you can plan and do something about it. Using feedback in therapy serves the same function. Sometimes there are problems that arise for patients and they're not immediately obvious to you as a therapist. Using feedback enables you to see in your blind spots, identify and therefore resolve potential problems alongside with patients. So if you're using a feedback system and the system alerts you to a situation where therapy is not on track, that should prompt you to do a few things. The obvious first thing to do is to open up a dialogue with your patient about that, and to frame it in such a way that it's a conversation that will help us both to learn about what's making things worse and what we could potentially do to make things better. So I would say something like, according to the questionnaires you completed, it seems like things are much more difficult for you this week by comparison to how things were last week. I'm curious to know what might be explaining that. Do you have some ideas what might be making things worse for you? So I open up a dialogue and we explore possible areas of difficulty. That could have to do with things that are happening in the patient's life that are leading to exacerbation of distress. It could be to do with difficult interpersonal relationships. It could be due to life challenges like financial challenges. It could be related to other associated health problems like a deterioration in somebody's physical health. The goal of this conversation is to explore potential difficulties so that we can then come up with a plan. So step 2, after opening up that dialogue, would be to start to formulate some ideas about what may be the things that are making things more difficult for the patient. And that enables you to generate what you can think of as hypotheses, clinical hypotheses. You don't know for sure if these are the things that might be explaining a patient's apparent deterioration, but you can formulate some reasonable hypotheses about what might be the challenges. It's a good idea to discuss these hypotheses not only with the patient, but if you work with a clinical supervisor, it's always a good idea to get an external perspective on which of these problems may be most likely explaining a patient's deterioration. So something else I do is to consult with a clinical supervisor. And the goal of that step is to come up with a plan. So you might make a decision to change something in the therapy plan, specifically because you expect that making that change might help to resolve the obstacle that may be getting in the way of effective treatment. So if I were to summarize this process, you could formulate it in a series of steps. First, attend to outcome measures and feedback systems if you have access to them on a regular basis. If that indicates that your patient's treatment is not on track, open up a dialogue to explore potential challenges or obstacles. Form hypotheses about what the most important challenges might be. Discuss those not only with a patient, but with a supervisor or a colleague or a peer. Make a plan, and then implement your plan to see if that makes a difference, if it helps to alleviate the patient's distress or to improve their functioning. If after implementing your plan, you find that things are improving, then that gives you some evidence that your hypothesis about the obstacle or difficulty has been adequately resolved or worked around. But if the patient remains not on track or their symptoms remain not on track, that might tell you that your hypothesis was not correct. And that might prompt you to continue to explore what else could be done, what could be changed to improve things for the patient.